Thank you very much. And I want to say a couple of things before I start. I'm getting used to this public speaking malarkey since I took up this job in March. But those of you who do public speaking will know that one of the big challenges when you speak to people you know. And in this audience, I'm speaking to some people I know. One of the biggest challenges is if your own family are in the room. But so when I arrived, there was a member of the panel who appointed me, so I thought, right, okay, Koualla, calm down, you just need to prove to the woman that you're worth appointing. Then I looked around, lots of friends. Then I saw my predecessor, Patricia, in the room, and I'm thinking, oh my God, I'm going to be talking about her work. So if my two daughters walk in, I'm going to be a wreck. So I'm just warning you, So firstly, thank you, Dirk, for the kind words. And I'm going to talk a little bit about who we are and what we do, but also about our relationship, Nikki's relationship, both under Patricia's leadership and now under mine with ARC and with both the Kids Life and Times and the Young Life and Times survey, and how we believe that's been a really effective way to gather the evidence to promote and safeguard children's rights in Northern Ireland. I'm not going to do the big spiel, you know who I am, or more importantly, probably you know what Nikki does and what we are supposed to do. Again, I took over as Commissioner for Children from Patricia in March of this year, and there's been lots of conversations about what it is, what are my priorities and what am I going to do to make the world a better place for children and young people. First thing to say, I can't do, nor Nikki can't do it on her own, it's part of a whole society thing. But some of the things that we have already started talking about in some of the external pontifications we've made are these areas. Education inequalities, and those of you who have been looking at the media know that I came out and talked about academic selection and how I didn't think it was fit for purpose for Northern Ireland. The interesting thing is I'm not the only person who thinks that. I suspect most of you in the room think that, and what I also know is the UN committee think that. So it's not me or Nikki, or colleagues in Nikki who think that, it's all of us who think that, and what we need to do is have that conversation. But our education inequalities are not entirely down to academic selection. It's part of a wider conversation that we need to have around education and how it's constructed here in Northern Ireland and what we spend our money on. I'll talk a little bit more about that later. Another thing, and is related to education, is child poverty. It's unacceptable. It's at unacceptable levels, and in view, it's not my job to be political, but I think it's safe to say, in view of what happened across the UK last week, it's going to get even more unacceptable. And we know that if we don't do nothing, if we continue on the trajectory that we're on around children and young people and welfare reform, so-called, and other cuts and so-called austerity, what will happen is that children in poverty will increase probably by 20% over the next 5 years. And that's just something that we can't stand by. And the other thing that we will be looking at is child and adolescent mental health. Across the piece, prevention, early intervention and services for children and young people, but particularly for those young people who need what is called Tier 4 services, those young people who we need to find inpatient or outpatient treatment, intensive treatment for and services for, and that's another area. And then the work that is continuing around monitoring the core work and government's work and scrutinising government's work on children and young people, and generally promoting and trying to ensure the framework that is required to implement the rights of children and young people in Northern Ireland. What I've said, which is where this relationship is so crucial, what I've said and has been said for many years in Nikki and other children's rights bodies, is that if you're going to make changes, you need to know what you're doing. You need to have a framework. And the framework we are using will be obviously the UN Convention on the Rights of the Child, because the law says I have to take that into account. Legally I'm obliged, it's in my job description. So everything we'll do will be based on furthering the rights of children and young people. The other thing will be is, of course, the voices, experiences of children, young people and their families, that they will always guide what it is we do and what we say. But the third thing is, which is what we're talking about today, well, second and third, is best evidence. What does the evidence tell us we need to do to promote the situation of children, young people? Can I ask somebody to keep me right to time? Because I could actually talk until... Yeah, so just let me know when I've got about 5 minutes to go, and then I'll come all like a seamless end. So this is where a relationship with ARC through these two surveys, Queen's and University of Ulster, has been very, very fruitful, because it's a way of accessing the views of children and young people in a specific way. So these are some of the modules that we have commissioned and we have worked with. And I suppose when talking to colleagues, and I'm sure Patricia would echo this, that it's been a relatively stress-free relationship. I think looking Alex, Head of Policy and Research, and Nikki's here, and has assured me, and I'm sure Patricia will confirm, that it's been a good relationship. I know from my previous life, and I'm going to piss off all the researchers now, that sometimes working with researchers, because of the way you have to do things and the constraints you have, can be very, very stressful. But I've been assured that, that the relationship with Dirk and the team has been relatively smooth and relatively straightforward. So for that, I'm very grateful on behalf of Nikki. And also to congratulate ARC for producing the results, because in my previous life, I have always gone to the Young Life and Times, particularly because I work for older children, young people, always gone to say, what are the big picture stuff that we want to look at? And I just make a plea to help me navigate your website a bit better. But other than that, it's always been the first port of call of finding out what children and young people think. So these are the, now I need to find out where I am because I've gone off on one. So these are some of the things we've worked on. And as you can see, we had questions. What I'm going to do is talk about what we've gleaned from ARC and how we're going to use that information and integrate it into our work, and how it's not just, here we are, here they are, how what ARC gives us, what these two surveys gives us, is some very rich material by which we can actually make a difference in the lives of our children in Northern Ireland. So I've talked about the benefits already. So it captures the voice and of a snapshot of children at a particular time. And the fact that it's the 10 and 11-year-olds and the 16-year-olds has been very helpful, because it gives you the primary and the post-primary and kids at different stages of their life. And also children, young people at transitions in their life. You know, we know P7 is a huge, huge transition time for children, young people, and we know that for 16-year-olds as well. That is often a very big transition. It gives us, like I said, the evidence to go forward. Also, if we want to do more qualitative stuff, it begins to help us to frame the questions that we may want to ask when we go into the focus group, and I'll use a case example of that in a minute. And that's always really helpful, because you don't want to go in with a completely blank sheet of paper, but at least if you've got a framework, and this sort of survey gives us that. The opportunity, if we're going to make changes, one of the big issues I have with politicians and some decision makers is that sometimes it's driven by media headlines, and we see that all too often. You know, I am competing, or Nikki particularly, and others like us are competing with Stephen Nolan to set the policy agenda. That is not appropriate. Not that your man doesn't have a place, because he absolutely does. But what we need to do, please don't be putting that on film, because that will do his ego the world of good. What we need to do is look at how we can get our politicians and decision makers to factor in the evidence when they're making their decisions. This is one of the biggest challenges. You know, I am sick, so and tired of sitting in a room with particular politicians and them looking at me going, no amount of statistics and evidence and international research is going to make me change my mind. And I'm thinking, well, what will make you change your mind? What we are trying to do is make a difference. And you cannot just take the headline from your local paper or a couple of anecdotal stories you've heard in your community in a snapshot of time. And this is what we need as a community. We need to get better at doing, being able to put the research findings within the children's right framework and articulate that better with the decision makers. because it ain't their problem, it's our problem. We have to, well, it is their problem, but it's our challenge is to get them on the same page as us. And this is great for doing that. So as you saw previously, we did a piece of work on shared education, and you've got some information here. And this is an excellent example of how we work with Young Life and Times and Kids Life and Times to capture and then use that information. So when the ministerial subgroup chaired by Paul Connolly and Patricia, if you have any questions about this, Patricia and Alex will keep you right, looked at the future of shared education in Northern Ireland. Nikki at the time didn't see where the voices of the young people, and then plugged that in, firstly through the two surveys, and then by looking at doing focus groups with, as you can see, 750 young people in a range of schools that had experienced shared education. And the findings were quite interesting, because there was lots of positives coming out of that for the children and young people, but significant minority of them expressed challenges. So they did talk about they liked the fact that they weren't separate. They liked the fact that they could meet new people. They liked the fact that they could meet people from different communities. What they were challenged, what the young people found very challenging about the process was that sometimes there was practical difficulties getting children into the different schools. It didn't always help them with the learning environment, because you were doing these cross-community things, which meant you were taking out times out of lessons, although I'm not sure why a child would think that, but anyway. The other thing is that they felt it was a little bit tokenistic in places, and also that they didn't like, some children didn't like being in the same class because you could feel the tension, and it wasn't very relaxed. So again, it was a minority, but it had, that information was crucial if we're going to move forward with shared education. I'm not going to get into the whole debate, and I know you've done some more work on shared and integrated and what have you, but the UN Committee on the Rights of the Child has made it very clear to Northern Ireland in its 2008 concluding observations that we had to end segregation in our education system. It made several recommendations around education. 2 were country specific. Both of them were for Northern Ireland. You know, the rest were for the 4 nations. But our little jurisdiction had 2 focuses. One was we had to end segregated education, and the other we had to end academic selection. So this is, we took that, and as ARC does, produce these research papers, which my desk is awash with at the moment for another piece of work I'm doing for tomorrow. We produced, when I say we, I mean Patricia, Alex and colleagues, produced an actual report so that there was evidence from the children and young people in order to inform the actual advancing shared education project. Moving on to, I think I'm right in saying that this is one of the findings coming out today. The United Nations Convention on the Rights of the Child says a couple of things around education. In its articles 28 and 29, and I have to do a test. I have the UN Convention posted all around the house so I can learn all the articles. It articulates that a child has a right to education, but that the aim of education is that it shall develop the child's personality, talents, mental and physical abilities to the fullest extent, as well as preparing them for an active adult life. I'm going to say the next key human rights instrument, because I'm going to keep talking about it until somebody takes it away from us, which is the European Convention on Human Rights. So wherever we go from now on, we must always talk about whilst we still have it, which absolutely makes quite emphatic that a child under its Article 2 of one of the protocols, that a child should not be, a person actually should not be denied the right to education. So Nikki thought, right, is our education system helping a child not only around straightforward education, but to develop these talents and abilities to make choices around how they become more rounded human beings. And actually the results are really quite positive. It's clear that education is a crucial part of a child's life, and young people felt very positive about it. I'm going to go back to some of the things they said, but the other thing is which really, this finding really freaks me out. I'm not sure that's a technical commissionery type term, but it does. Do you feel important in your school? Just over half of our P7s and nearly 2/3 of our 16-year-olds felt they were important in school. The fact is that means just under half and 1/3 of our children in what is year 12 don't feel important in school. If not them, then who is important in school? Why is that figure? That figure needs to be in the high 90s. There's always going to be kids but it does make me wonder, school and our health service, who is it there for? Because there are quite significant minority of young people, children and young people telling us it's not for them, that they're not the centre and the focus of what goes on in that schoolroom. And that worries me quite a lot. The young people talk about how school has helped them to deal with the challenges, and you know, I'm not in a position to say whether this is a good figure or not good, because a lot of children don't have challenges and therefore don't need help or get help from outside. But the fact that so many young people feel that they have been helped with other challenges going on in their lives is really reassuring. But what it does tell us is what we need to do, what services, training and support mechanisms we need to be putting into our education system to support our teachers, but also bring in complementary services, because there's only so much we can ask our teaching staff to do. So young people have talked about how they feel that the things they were helped with, which is, you know, being able to control and understand their emotions better, obviously learn how to deal with bullying, to give support when very difficult issues have happened in their family, whether it's family breakdown or whether it's a bereavement. You know, just to give a personal example, my children lost their a grandparent on either side within 10 days of each other. Now, the fact that they had two parents who were completely in pieces clearly was going to impact on their education, and that was shown very clearly. My eldest was in secondary school at the time, and her marks during those few months were devastating. You know, they dipped. Now, some teachers remembered that I'd rung and said, this is what's happening in this. Others forgot, and the difference in attitude was amazing. Now, they had support. We moved on as a family, but if they didn't, you know, that had a massive impact, and that's just a wee thing, let alone some of the massive issues children and young people are bringing into school when they come in. If I had a penny for every time a teacher told me they weren't a social worker, then I would be quite rich. So I think what this survey, the results coming out today, and we'll look at them more closely, is it needs to be a lesson to our education department about the services they need to put in for our children and young people. The other thing I also talked about is Mark McCann in the room, because I always get very nervous if I'm quoting somebody who's, oh, that's good, that's reassuring then. I talked about adolescent mental health. This isn't a question that Nikki put in, but it's something that I really have welcomed when we're beginning to enhance our work around adolescent mental health within Nikki, is what are young people saying about them? The figures of young people who have not self-harmed, you know, most young people don't self-harm, but we're getting a slight increase in the figures. But what the second statistic there is that less young people are seeking help. And again, that speaks to the nature of our child and adolescent mental health service. And I got this from the research update that Mark did, that published earlier this year. So there are huge issues in our child and adolescent mental health service. We actually don't know. What we do know is general mental health amongst young people across the world needs to be better understood. But we haven't yet fully captured the impact that the particular situation in Northern Ireland has on this generation of young people who were born after the ceasefires. And we know that it has a continuing impact on them. The conflict has a continuing impact on them. And we are still yet to fully understand what that means. We also know, and this is figures that the Children's Law Centre got in a Freedom of Information request, that whilst it's estimated that similar numbers, 1 in 5, of both children, young people and adults are affected by mental health issues, what we know is that just under 8% of our mental health budget in Northern Ireland is spent on children's services. So surely prevention, if we had rounded services, and I heard on the radio this morning what's going on, and this sort of information is crucial. And we've had calls again and again and again for more, am I getting close? For more and more in-depth research so that we can understand the issue of children and young people's mental health. And our QIA have been quite emphatic on this. I'm glad I've only got 5 minutes to go because this is the more difficult thing. The other very quickly, just to say that awareness of the Children's Commissioner's Office seems to have dipped over the years. But the good news is that awareness of the United Nations Convention of the Rights of the Child has gone up. So there's a good news and bad news here, which is great. So my ego tells me I want it to go up because I want to know everyone to know who I am. But really, what I really care about is that children and young people know about the UNCRC, and what we will do going forward is see if they understand what their rights are, and also ensure that children and young people and their families and carers and significant adults are able to advocate for their rights. Very, very quickly, in 2008, the United Nations Committee on the Rights of the Child hammered the UK government around negative stereotyping of children and young people, and said they had to take urgent measures to address the issue. Well, here we are 7 years later, and neither urgent or what I would call the measures have been taken. And this was something that questions Nikki had put into the Young Life and Times coming out of the concluding observation. And you'll see, and I'll go very quickly, you'll see that young people feel they are discriminated against in everyday life across Northern Ireland. This is why this is really important I talk to you about this. You will have heard me talk about anyone who hasn't got anything better to do than listen to what I say, but you will have heard me and Patricia and Nikki previously talk about age discrimination legislation. We cannot discriminate in the provision of goods, facilities and services against people on the basis of their gender, of their sexual orientation, of their race, and a few other things. We can currently on the basis of their age. So you can deny a service to a middle-aged woman because she's a middle-aged woman. Our government is considering legislation to rectify this issue. They announced in that should have said February 15, sorry. They announced in February 15, but it came from years of work beforehand, that they're going to lay a consultation, which will probably be in the next couple of weeks, which will herald the introduction of age discrimination legislation, but only for 16 and above. Now, the irony of that cannot be lost on anybody, that we're having age discrimination legislation that discriminates against people on the basis of their age. And this is really, really important. It goes back to what I've said about evidence. We, and Nikki particularly, but others like Children's Law Centre and Northern Ireland Youth Forum have known about this and have been working diligently with government and other decision makers and with the Equality Commission to provide robust evidence-based advice and guidance as to why there is no reason, and actually it's contrary, there's no reason why you cannot why you should be able to discriminate against children on the basis of their age. The evidence is irrefutable. I have yet to see an argument that knocks back the evidence that Nikki and the Equality Commission, Children's Law Centre and the Northern Ireland Youth Forum and other people in the children's sector have put. I haven't seen any evidence. There is no evidence. We have got robust evidence as to why we need to have an all-age discrimination legislation, and yet, our government chooses to ignore what our children and young people are telling us, what our legal advisors are telling us. What I would ask you all, if you do nothing over the next few months, and I know you've all got a lot to do, please engage with this consultation, because it sends a significant message to children under the age of 16 and to their parents and advocates who are their advocates for their rights, that they don't matter. So we need to be better at using the evidence, but even when we have it, they're not hearing us, and we need to find more creative ways of hearing us. I'm happy to take questions. I'm going to be bold and suggest so is Patricia and Alex. Happy to take questions on anything that went before me, and that's me. So thank you very much.